All right, hello everyone. So this is Dr. Tushar Mehta. I'm an orthopedic surgeon and your faculty of orthopedics. Well, today we are presenting a new kind of a spectrum in our OrthoBuddy app, which is meant for you people, for the PG residents, the MS, the DNB residents of orthopedics. So certain topics they go unnoticed. We miss them. Uh, they're not important from theory point of view, from exam point of view, but what happens is that maybe in your OPD, maybe in your wards, maybe in your short cases, one day you see something like that. So in this section we will be discussing those unusual but can be asked clinical questions with all of you. I'm sure you all can see this swelling here. There is nothing extra that I need to tell you. Sabko swelling dikhai de rahi hai. Let's take the history. So it's a 6-year-old boy, male, who has a painless, mind you everyone, painless prominence in the right middle one third of the clavicle, and this problem is congenital since birth. So painless prominence, middle one third clavicle from birth. The family clearly says that there is no history of trauma. There is no history of a similar complaint in the family in the elder sibling. It's a clear cut normal vaginal delivery, although twins. Normal milestone achieved by this kid. No history of fever, no weight loss. Point to be noted, my lord. Don't think about any cold abscess or anything of that sort. In fact, there is no history of loss of appetite as well. So this kind of gives you a hint that examiner is not very willing to ask you tuberculosis. This is very this gives you a hint that examiner is not willing to ask about any non malunion or anything of that sort. And since it is painless, so we need to see what it is. By the way, uh, it is something which again I would say can be asked in your short cases. So let's go for clinical examination. I told you it's a clinical case, so we will proceed clinically. Let's go for clinical examination of the right clavicle. So first of all, the most important thing is that it is a painless prominence and it is in the middle one third of clavicle and it is quite firm. Now, this prominence is mobile in nature, you can move it. In fact, the clavicle adjacent to this can also be moved. The most interesting thing, that range of movement of the shoulder is absolutely free, no problem. No winging of scapula, no cafe spots. Want to be noted, my lord. Don't think about neurofibromatosis and various conditions associated with neurofibromatosis. No skin changes, although skin over this becomes quite thin and shiny, but still no distal neurovascular deficit. Don't think about any artery aneurysm or anything of that sort. So till now we have understood that there's a boy who has a prominence, subcutaneous prominence in the right side, middle one third of clavicle, and there is no history of trauma, there is no history of weight loss, there is no history of appetite loss. Absolutely neurovascular, distal neurovascular system is absolutely fine. It is quite mobile, although firm, and range of movement is free. So guys, now let's get an X-ray and a CT scan. So this X-ray clearly shows there is a discontinuity between the two ends of the clavicle. This CT scan with 3D reconstruction clearly shows that there is a discontinuity between the two ends of the clavicle. This is not a malunited fractured clavicle. Mhm. This is not a malunited fractured clavicle. This is a condition that is called as CPC. What do you mean by CPC? CPC is congenital pseudoarthrosis of clavicle. This is called as congenital pseudoarthrosis of clavicle. Let's go for investigation. The routine blood investigation will absolutely be normal. X-ray and CT will show you the pseudoarthrosis. Thoda sa, let's try to understand. Clavicle has two primary ossification centers. Okay, clavicle has, as I said, two primary ossification centers. So one ossification center is somewhere here, the middle ossification center. There is a lateral primary ossification center. So there are two ossification centers, primary ossification center, medial, lateral. Ideally they should fuse. Failure of fusion of those two medial and lateral ossification center gives rise to a condition called as CPC, congenital pseudoarthrosis of clavicle. This is the first point. Second point, you cannot appreciate any periosteal reaction, and you can appreciate some sort of a fibrosis probably around. You can appreciate some sort of a sclerotic bone. You will open it, you will find it. So there is failure of fusion of the medial and lateral primary ossification centers of the clavicle. Second point, there is hardly any periosteal reaction. Third point, it will always present as a painless prominence. It will always present as painless prominence in the middle one third of clavicle with interesting point, no problem at all. It is more of a cosmetic issue. Don't worry, we'll talk about it. It's more of a cosmetic issue. Now, what was done in the management? We have still not discussed this topic, but let's talk about the management. Management is very simple. In most of the cases, you have to open it. And once you open it, you have to resect the pseudoarthrosis. Then you put a tricortical graft, and then you do a plating of the clavicle. So this is when you open it from the approach. This is the entire pseudoarthrotic part. You have to excise it. Once you excise it, these are the two ends of the clavicle. I'm sure you can see that. So these are the two ends of the clavicle. After excision of the pseudoarthrosis, these are the two ends of the clavicle, and we have a tricortical graft. So you put a graft over there, you fix it with a plate. So open reduction, internal fixation, rigid plating, tricortical graft, along with resection of the pseudoarthrosis. Basically, we are talking about what? As I said, we are talking about CPC, pseudo congenital pseudoarthrosis of clavicle, or some people call it CPAC, CPAC. I have already given you the brief that whenever there is failure of ossification, primary ossification centers of medial and lateral side of the clavicle, that is basically called as CPAC. It is a typical congenital problem. Of course, it's a rare problem given by Fitzwilliams. Nobody will ever ask you. Girls are more commonly involved as compared to boys. It is usually unilateral, more so in the right side. Okay. Periosteal reaction is absent. Failure of ossification centers we have discussed. Painless, firm, yet mobile. Uh, Prominence, subcutaneous prominence under the middle one third of clavicle. We have already spoken about it. Initially, it is not a big issue. You see a slight bony bump, but later on you see that deformity tends to be more obvious with the growth. Skin becomes thin and atrophic. We have already spoken about it. Now, I'll tell you very honestly, people get it operated more for cosmetic purposes rather than anything else. Majority of the cases which I have seen, like I have not seen much, I've seen hardly 4 cases. But out of all those 4 cases, one opted for surgery, and that too for cosmetic purposes, that's all. Otherwise, it can lead to progressive pain, it can lead to functional limitation. Of course, with the growth, it can lead to thoracic outlet syndrome. So if there is progressive pain, functional limitation, thoracic outlet syndrome, or cosmetic purpose, you can get it operated. So I have already told you that surgery is the only solution. Apart from that, there is no other solution. It should be done between 3 to 6 years, and very simple, fundamental, that resect the pseudoarthrosis, fix it with a graft, and then do a compression plating. All right, so with this, we come towards the end of this very interesting, you can call it a clinical spotter, you can call it a short case, you can call it anything you want. So, this series that we've introduced today in this particular section of clinical questions is to, give you an idea, like if you've seen this video, if you have heard what I've told you, then probably one day you will see something like this. An examiner will ask you, okay, what is this? You'll be like, sir, you feel it, you'll be like bony swelling. Okay, what can be the causes? And then you start thinking that what can be a cause, some artery aneurysm maybe, or maybe, some malunited clavicle. But if there is no history of trauma, do not expect malunion. If there is distal neurovascular, which is fine, then don't expect of any aneurysms. So aneurysm has to be pulsatile. It is not pulsatile. So the one thing that doesn't come to your mind is that it can be a pseudoarthrosis of clavicle, and then your viva will go into that direction, which we have discussed. So I wish you all the best, and I hope you're watching the rest of the videos as well. Thank you so much. God bless.